that are not validated by science, but we're trying to find that balance between adhering to the scientific realities that we know on the one side and responding to the public anxiety on the other side. That's a tricky balance to find, a very tricky balance to find. So this is what we're attempting to do right now, and all public officials in all communities are trying to do that.
This has reached a major metropolis here in New York City. What do you say to people, say in Philadelphia, who may be worried, geez, it may spread there next?
Well, it's inevitable, in my view, that we're going to have sporadic cases of Ebola in many large cities around the United States. And maybe even some not large cities, some smaller communities, because it just depends on where people go who might have been exposed and might actually have the disease. So we have to be prepared for that, and which is why every government, federal, state, and local, is making an effort to make sure that all the hospitals in America and the healthcare providers know what they're doing. Now, here's another point here. Over the last decade, we've cut by 50% the amount of funding for the hospital preparedness program and 30% for the public health agency. So we've lost 50,000 public health positions since 2008. And there's a job here for Congress and the White House, which is to restore that funding immediately, because on the one hand, the CDC is legitimately requiring hospitals or recommending to hospitals that they get prepared, they do training of people, and they stock up on the supplies they need. At the same time that the funds to actually support that work are diminishing dramatically over the last few years, and that's something we're going to have to get a handle on.
As a medical professional, you saw that he took precautions, he
Yes.
took his temperature twice a day, seems pretty early. What do you think his outcome is going to be like?
It's very hard to tell, because often there's, in the first few days of illness, there's a period of time where you're pretty stable, everything's okay, and then things can crash. In this case, this guy is in a world-class institution. He's not going to get the dehydration, which actually kills a lot of people with Ebola. He's going to have everything supported. He's going to get kidney dialysis if it comes to that. He'll get everything you could possibly need to support your life vital signs and all that. So the issue is, will he get overwhelming infection at some point and then require one of these innovative or experimental therapies? That might come to pass. That's a decision for his doctors here with other authorities to make. We'll see. But everybody's hopeful about him, so far so good. So he's not really much sicker really than he was when he came in yesterday. His fever's about the same and all of that.
And you read...
You said it's going to spread. You said it's going to spread to major cities as inedible. What steps do we need to take to make sure it doesn't turn out like it did in Dallas?
We got to deal with it in Africa. There's too much movement around the world. There's too much travel. There's commerce. There's many West African communities in the United States where people are going back and forth to visit. There's no way to stop the movement of people around the world at this point in our history of the world. There's no way with the amount of travel to really limit people coming out of there and potentially spreading the illness.
And you said you wouldn't have had concern riding on the subway with him the day before he admitted it?
Seriously, I would not have any problems myself or any of my family members, my kids. We all live in the city, and I would not recommend doing anything differently, but do what we normally do. We got to go to work, we got to go to school, we do our thing here. And there's a level of anxiety which I think is appropriate for people. So the recommendation we give to people, and generally in the public, is try to learn the facts so that your anxiety doesn't exceed what we actually know to be true. So, yeah.
How is this being handled differently than what we saw in Dallas?
Well, it's totally, utterly different, and everyone in the healthcare business feels, in a way, thank God it wasn't us, because those same kind of mistakes could have been made elsewhere. I don't think that's going to happen anymore. I think there was such drama and focus on what happened in Dallas. It's very unlikely that we'll see some of those horrendous mistakes that were made, by the way, not only in the hospital, but by the public health agencies. They left those primary contacts in their apartment for 7 or 8 days. They didn't even remove the contaminated bed sheets and all that. It was eye-poppingly disturbing to see what went on there. But everyone saw it, and no one wants it to be repeated. And I think that's what we're seeing now. A very significant attention on all levels of government and all the health agencies and hospitals, a focus on this. But I want to just point out again, so the CDC and all the state health agencies are strongly recommending very stringent guidelines about training and retraining hospital staff, about stockpiling the appropriate personal protective equipment, and without the money to do that. A third of U.S. hospitals are on the brink of financial instability in a very serious way. So when the funds were cut back federally, a lot of hospitals dropped their preparedness programs. So now we're recommending, well, you train and retrain, do it monthly, do it weekly. And many hospitals don't actually have the capacity to do that. They're struggling with it, and they'll get it done, but Congress has got to get in there, and they've got to restore those funding.
Last question for me. Have you heard anything about his fiance? She was obviously with him right up until the point. We heard about Duncan's family didn't get this. What are you hearing about that?
Well, there's a lot of attention now on the primary contacts of people who end up with Ebola, and a lot of focus on the fiance and the two close friends of his that he spent the most time with. So far, nobody's had any symptoms, and nobody's really in danger, and so they're just watching them now.
That's still the case, to your knowledge?
Yes, it is still the case.
The fiance and the two friends?
Yes.
Can you give us an update as to how he's doing right now?
Well, I'm not caring for him. I haven't seen him. All I know is from people I spoke to earlier this morning, and he seems to be stable. So his fever is still in the same very low range that it was when he came into the hospital yesterday.
How many people is working with him? I mean, like, he's supervising.
I don't know the details of that. You mean like doctors and nurses and all that? I don't really know. So there's going to be a teams of people in shifts that are going to be caring for him. These are all exquisitely trained healthcare workers in the right kind of environment for a patient like this, and he'll have every chance of getting through this that you could possibly have, including access to whatever experimental treatments or therapies that his doctors may feel might be necessary.
About the access, it's not very complicated to get to the floor he is now.
About
the access, it's not very complicated to get to the floor he is now. Is there any control like you're going to have there?
Is what?
Like any control that you're going to have since then?
Oh, this is not my hospital, so they're going to do what they do in here, but it's under very strict control, obviously. So it won't be people like wandering around the floor that he's on.
All right, guys, we're out of time.
Okay.
Some of us came up late because we were going live talking about this story. In terms of immediate concerns, can you talk about what concerns people should have in terms of
the general public?
The general public. There's a lot of misconceptions, a lot of concerns.
So this is worth repeating that the general public should not be worried about contracting Ebola from Craig Spencer, period. I'm talking as a father and grandfather of family here in New York City. I would not have the slightest hesitation about any of us going on the subway, which we do, or anything else that we normally would do. And I think the problem here is it is a scary disease, there's no doubt about that. So there's a level of anxiety here. There's been a lot of attention, obviously, on this disease, but the main thing is for people to try to learn the facts about what actually is contagious and when people are in danger or not. And it's been repeated a lot, but unless you're in contact with the bodily fluids with an Ebola patient who's symptomatic, you are not going to catch it from them. If any of you had Ebola right now, I would have no problem. If you weren't symptomatic, you're in that incubation period, I'd have no problem chatting with you at this distance that we are right now. And as I said, I would go on the subways, I would do whatever I normally would do. It's hard, and I understand it's difficult for the public to get this, but I think it's important that we not shut down normal life because one person is in a hospital here in New York City with Ebola.
I think I asked you, this special CDC team that was sent here, do you know what their role is? What exactly, are they here to monitor protocol? Or
they're monitoring protocols, they're here to be assistants. The reality here in New York City, this hospital, I doubt that the team from the CDC or anywhere else has anything to add to what these people know here and what they're doing. It's good to have the reassurance, and we're getting calls from around the country, even from the nationally designated major hospitals, anything they can do to help. And the hospital and the public health system are very receptive to any advice or help. But here, you're in just as good shape as you would be in any hospital anywhere